So today we're going to talk about peptides. Peptides has gotten a lot of media coverage recently. Oftentimes when you go to the store, you look in the pharmacy section or the nutraceutical sections, you see peptides plastered on all kinds of labels. It's a big buzzword, but what really are peptides? Peptides are basically strings of amino acids, and amino acids are the building blocks of protein. Anytime we eat any kind of meat or anything protein-based, your body breaks it down into amino acids, and oftentimes it'll form other things that it needs. Those other things would be muscle. That's probably the biggest use of protein, but it also is used to make amino acids. It's also used to make peptides and other proteins needed to help the body function how it does. So when the body forms these peptides, or if they're injected or taken orally, the body uses peptides as a signaling message or a signal from one part of the body to another. Our cells make peptides and proteins, and oftentimes when it does that, it sends a signal with the peptide from one cell to another to do a specific action. So that specific action could be to make another peptide, it could be making a hormone. Another thing to keep in mind is that peptides often act similarly to hormones in the fact that they're basically signaling mechanisms. So most of our cells have what we call receptors, and when a peptide is sent out into the bloodstream, it will bind to a specific cell's receptor, in which case that cell will then be signaled to perform a specific action. One of the most common peptides is insulin. Back in the earlier 1900s, when insulin was discovered, it was designed to help type 1 diabetics who no longer produce their own insulin basically save their life. When it was injected subcutaneously, and that's basically just right under the skin into the fatty tissue, that then is used to help transport glucose from the bloodstream into the cells to be utilized. Without insulin, diabetics, sometimes type 2s as well as type 1s, aren't able to utilize the sugar in their bloodstream, and that comes with a whole host of downstream effects and long-term chronic problems. Some of those chronic problems are going to be heart disease, strokes, heart attacks. Those are some of the major ones that we see. So there's various classes of peptides. Some of the more common ones are going to be growth hormone related peptides. These interact with the pituitary gland and help your body produce and secrete a little bit more growth hormone than it typically would otherwise. As we age, a lot of our hormones and peptides just gradually decrease or decline as we get older. That's just a natural process of aging. One of the nice things about peptides is that as we age, if we use peptides exogenously or inject them or take them orally, our body is now able to utilize those peptides to help increase the amount of hormones that our body otherwise had when we were younger. Oftentimes the decline in peptides or hormones as we age starts to happen in our 30s and certainly more so in our 40s and 50s. So one of the more common peptides that we use is called a GHRH, and that's basically a growth hormone receptor hormone. And basically what that does is it helps stimulate the pituitary to excrete a bit more growth hormone. Growth hormone has many uses in the body. It's very broad and not necessarily specific to any one thing, but some of the more common things that we see are increased healing, increased fat loss, increased stamina, increased muscle growth. Those are probably the more common things, in addition to a bunch of other things that the growth hormone can do. It's important to note that you don't want to overstimulate the pituitary gland because too much growth hormone also has negative side effects. At Revive Health, we want to make sure that we tailor your individual treatment to your body. So typically we would check some labs. We want to check your hormone profile if we're going to be prescribing peptides. This in turn will give us a better idea of what your body is doing from a hormone standpoint and how we're best able to help modulate what peptides can do for your body. We also want to make sure that we avoid unnecessarily using peptides when it's not indicated as well. Peptides can come from a couple different places. One of the major places that you will most likely see peptides coming from will be online vendors. The problem with online vendors is that there's no regulation. The FDA does not govern or regulate these vendors. And the main reason is because when you order them, they will come to you and on the bottle, they will say for research use only. So the problem with this is that you're not exactly sure what you're getting in some of these or from some of these vendors. Typically, from what I've seen, is you do actually get the peptide that is promised to you. The problem is that there's oftentimes other additives or substrates within there that you're not really sure what you're getting. Oftentimes these peptides from the online vendors originate in China, and that's not bad in and of itself. However, again, you're not really sure what the other additives are that could be in there. The second place that you will typically be able to get peptides from will be from a practitioner's office or online telemedicine office. These will then be coming from a compounding pharmacy, and compounding pharmacies are governed and regulated by the FDA, so you can rest assured that these peptides come from a reliable source and that there aren't any harmful additives inside of them. Another thing to note about peptides is since everyone's a little bit different, everyone's individual, you want to make sure that you're working with a practitioner who understands peptides in general. There's a lot of nuances to them, and again, we want to make sure that we're not overprescribing peptides and that we're giving you the appropriate treatment, if it might be peptides or something else, for your particular individual situation. In October, the FDA ruled that some of the peptides that were more commonly prescribed and used were ruled to be unsafe. So we're not really sure what the motivation was for this. However, unfortunately, we will not be able to use all the peptides that we have been able to use in the past, or the ones that most likely you've heard about other people using if you're in the peptide space. The good news, however, is that there are a lot of other alternatives that are still just as safe and effective that can also help you achieve the desired outcome you're looking for. At Revive Health, we're happy to see you, and we'll talk about your individual situation, your goals, and how we can best help you in your journey to wellness.